Hi everyone. So, can you train to be right? So first, left-right question. Which feet the arrow is pointing to? So I'll give you 4 seconds there to answer that question. We normally answer left-right questions in a split second. So we'll come back to them as well. So we're going to kind of set the scene about how we choose left-right, talk about the research, and then to summarise and see if he's got the questions right. Did everybody see the arrows pointing the wrong way? So something maybe so simple, we actually can overlook if we're distracted. So we've already seen a bit of this slide already. The first thing we have to look at when we choose left and right is it relevant to yourself? That's egocentric, so is it my left or my right? And then the next thing is it in reference to somebody else or something else, the extra egocentric. And we've all these other sensations that we have to look at: language, tactile sense, or vision, and we have to incorporate them in our memory. And then also it's been brought about the mental rotation, because that's an adult difficulty. So when I look at you, my left is your right and vice versa. Quite common in healthcare. As we've already approached on, there's a number of reasons why we get left and right wrong. Cerebral asymmetry has already been said. Gender, we postulate males are better than females, but not robustly proven. Genetics, some illnesses have that as well, such as schizophrenia can have elements of left-right problems. Acquired, brain injuries. Cognitive load, so the more things we have to focus on, something can slip. One of those things that can slip can be our left-right decision making. And again then, mental rotation, depending on what situation we're in. Is it really important? Well, left-right errors is a never event in healthcare, and it's normally incorporated under wrong sight errors. So we have to look at it specifically, and normally it happens in areas where there's bilateral organs, like our eyes. Unfortunately, these do happen in wrong eye surgery. As we said already, these figures are actually on an increase, and part of that there is actually how these are being reported now, because that situation was changed in 2015, 2016, and it's not just in the UK, it's all over the world. This is happening approximately 1 a week in the US. 2016, 2017 never events data highlighted is the specific wrong side operations, such as the wrong brain, wrong side of the chest. And you might think, okay, that's 2-3 years ago, are we getting better? I said there was 41 there. Well, the preliminary data for 2018, 2019, and that's over 9 months, 10 months, there's 35 of those areas, and again, it can be the wrong side of the lung, wrong side of the brain. And so what are we doing to try and help reduce these errors further? Well, there's the systems-based approach, so we've already been in through. But then what about the person? What are they doing to help try and reduce their left-right errors? The systems in place are a number of checklists, like the WHO checklist. There's been non-technical skills being incorporated, such as situational awareness, and more common now is the human factors, which has been developed, especially in the anaesthetic and the surgical fields. But so what about the individual? So we've heard about the L for left, or you're right with your right, for example, but none of them have been robustly shown to help. So what else can we do? So we went into another field of applied behavioral analysis, and they've helped train individuals with intellectual impairment new skills to high degree of fluency, which means they can do that skill fast and do it accurately. And they use the method they developed, precision teaching, and if you use flashcards with that, they call it Say All Fast, Minute Every Day Shuffle. And they SAF minutes were short. And depending on the flashcards, they've got a question. You may have to say the answer, which is C, say, or you may have to, the question, you may have to point to the answer, C, touch, or act the answer. Different channels, they call that. Does this really work? Well, their research is showing that the skill that you've learned with that, you can retain it over years. You can endure it, so you can do it in one sitting for a prolonged period of time. It's stable, even in the events of distraction, like we've seen earlier on. And you can apply it even to new situations that you've never been in before. Does it work in healthcare? Well, it's already been tested in dermatology and IV fluid prescribing with success. So that developed our research question of the impact of precision training on medical students' left-right discrimination ability. And to answer those, we had to, first of all, define how are we going to test their left-right ability, develop our own left-right flashcards, and then get our feedback on it from the students. So this is the Bergen left-right discrimination test. It consists of 3 sections, each one harder than the next one, 48 stick figures in each section, and you have 90 seconds to complete them. It incorporates images from the front, back, and then mixed. Our study was 40 medical students, control and intervention group. Each participant did a pre, Bergen LeftRight test. After 5 days, they did a post-Bergen LeftRight test, and the intervention group got the LeftRight self-made cards to practice twice a day, supervised, and then they could also do it on their own. So this is my Steve Jobs moment. This is my iPhone. Unfortunately, I never get the standing ovation he got every time I do this here talking. But these are the LeftRight flashcards. That's what's inside this box. And we developed 80 of those. Each of them have a healthcare picture on it with a question underneath with the answer left or right. And you practice these over 1 minute, so it's short blasts of practicing. This is a picture of a video of how we use them.
Types. This one has a photo with an arrow and a question which relates to the arrow. Left or right hand. Choose your answer. Right. Check on the reverse. I got this correct, so place on a correct pile. The second one has a picture with a question below. Left or right arm behind head. Choose your answer. Right. Check on reverse. I got this incorrect, so place on that incorrect pile. The third one has a picture with a question below asking you to point. Choose your answer by pinching the side of the card that you think is correct. Check your answer on reverse if the arrow is pointing towards the side.
So with that, you obviously do it a lot quicker over the 60 seconds, but that's just a demonstration. So for the results of it, our control intervention groups were similar for age, gender, which hand they use, if they used one of those techniques, and their perceived ability of choosing left and right. As it was a part study and we reached our part sample size. Overall, with regards to the Bergen LeftRight test, although the intervention group did improve at a fast rate compared to the control group, it wasn't statistically significant. So then we went down into each of the subsections of the Bergen LeftRight. The facing away, which is the easiest section, the facing towards, which is the moderate difficulty section. Again, although the intervention groups were improving at a fast rate, it wasn't statistically significant. We went into the mixed group, which is the most difficult. The intervention group at this time was improving at a fast rate again, and it was statistically significant with a small to medium size effect. And we looked at that data even further, and it was showing that the participants who are feeling more challenged with left and right improve at a fast rate with this intervention. With the using of the flashcards, the biggest improvement over a minute was 44 cards, however the smallest improvement was 2. And this is just a demonstration of one of the participants
left, right, flashcard
using the cards.
Right, 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 left, right, right.
So we'll stop that there. In that video, we actually had him to slow down to actually say the answers each time. Otherwise, it just looked that he was just flicking cards across in a video. So trying to explain the results, well, the mere measurement effect or the Hawthorne effect shows that when we try and measure something, people may subconsciously focus on more on what's been tested. So people that are more challenged with left-right, they may have put more effort into choosing left-right in the easier and moderate difficulty section, thus the reason why that may not have been statistically significant. Cognitive load. This was in a test environment. All they had to test was left-right. They had no other distractions. So people that had more challenge with left-right difficulties were maybe to develop their technique for the easier and moderate difficulty sections, but then went into the more difficult section. That technique's not in the long-term memory, it's not intuitive, therefore that's why we got a statistical difference. Systems thinking, which was broached earlier, system 1s are fast, intuitive, automatic, system 2s are slow, methodical. And again, in the easier and the moderate section difficulty, those participants could have still used their system 1 abilities of choosing left, right, but in the more difficult, the poor differentiators had to go to system 2, where the good differentiators could still use system 1. The ceiling effect, well, it shows that if we have a test and we can get high marks or near high marks, it means we can't differentiate that cohort there. Now, in our analysis, we actually went back and looked at it, and in fact, in our post-Bergen LeftRight test, 55% of participants were actually able to score over 95% in that scoring system. So, when we look back at that, for this cohort, we would probably have to modify the Bergen LeftRight test to get a better differentiation of that cohort of 55 participants. We also did 6 focus groups to get a bit of feedback from these. 4 to 6 participants each in each group, and we have approximately 2 hours of data, thematic analysis to use this. We got feedback on our flashcards to say that they were good quality and it helped them engage in the study. Some of the barriers were that some people thought, LeftRight, this is a simple way of doing this. But then when they throughout the study, they realised that some of their colleagues couldn't tell left and right, so they realised that actually it's not really easy for some. And then further on the study, when they were doing it and trying to beat their previous score, the faster they went, they realised that sometimes they can get it wrong too. And it ended up being one of the big consequences was that increased the awareness that we all can get it wrong, whether we're good or do we feel that we're poor at using LeftRight. Some of the quotes, I'll just draw attention to the bottom one really, and it says, I think if I learned anything, it's more how much time I take over a decision from left and right. Because I do find it simple if I take my time, but if I'm rushing, I can make mistakes. So back to the first question. Did we all get the top one right? Or left, sorry. And the bottom one? Well, sometimes we said it's the orientation sometimes help us, so if we switch them around a different direction, it sometimes can help us see which way or help our decisions left and right. To summarise, left-right discrimination, I feel it's a variable skill, but it's actually quite a complex skill. The left-right flashcards, we feel that the biggest benefit will be in individuals who've got a poor left-right discrimination ability. And overall this, it's definitely increased the awareness that we all can get it wrong, whether we feel we're good or we feel we're poor at discriminating left and right. Let's leave you this one quote. And any more info, Google here, and if you want to test the flashcards, give me a tweet. Thank you.